friend.
Thank you. We've discussed here the issue of bankruptcy, and I got a call from my daughter this afternoon, and she said, "Dad, thank God I'm a nurse and I have insurance. Mateo's arm, which was badly broken and required surgery, will probably be a $70,000 event." She said, "If I didn't have insurance, we would have lost our house." That's the situation that's faced by every family. It's faced, thankfully, this was not the situation that my daughter and grandson faced, but it is faced by hundreds, indeed tens of thousands, if not hundreds of thousands of Americans. And it's right here. The insurance companies dominate these markets. Lifetime benefits. She probably has already run through her lifetime benefit. That child is probably going to be uninsurable because he has a pre-existing condition, a badly broken arm. Those days are over. I'd like now to yield to my colleague from California, a magnificent representative with whom I've worked with for more than 34 years. She was a California state senator and took over my position when I left the chairmanship of the California State Senate Health and Welfare Committee. Representative Watson.
I just want to say to my colleague and those here on the floor this evening, I am so proud to share the space in this chamber with the likes of you, and particularly you, Congressman Garamendi. And he was correct in saying that, yes, when I got into the Senate, he relinquished his committee, and I held it for 17 years. And I think he probably is aware of my feelings at this moment. I have viewed the ugliness of today, Congressman Garamendi, that is so reminiscent of what I went to when I was on the school board in the 70s, and we had to integrate our schools. And I was the only person there who was an African American. And I had to endure the slurs that were heard today. It was absolutely ugly. The use of the N-word, spitting, the ranting, the distortions, the slurs, and the deceitful references to our health care reform. And I felt it was despicable. I didn't think it could happen again here in America. But I'm reminded that hate continues. Why should there be ranting and raving when we're trying to cover the 38 million Americans without health care insurance? And 8 million are in our state, California, and 6 million of them are children. And I want to say that the legislation that we are addressing will make health care affordable for the middle class. I don't know how many people out there ranting were middle class, but this definitely will help them. It will provide security for our seniors and guarantee access to health insurance for the uninsured. And I just want to very quickly mention what it will do for the 33rd Congressional District, that is my district, in Los Angeles, Culver City, California. It will improve coverage for 304,000 residents with health insurance. It will give tax credits and other assistance to up to 173,000 families and 15,100 small businesses to help them afford coverage. It will improve Medicare for 75,000 beneficiaries, including closing that donut hole. It will extend coverage to 132,000 uninsured residents. It will guarantee that 22 6,200 residents with existing conditions can obtain coverage, and certainly their children, starting when the bills are signed into law. It will protect 1,100 families from bankruptcy due to unaffordable health care costs. It will allow 66,000 young adults to obtain coverage on their parents' farms until they're 26 years old. Isn't that exciting? It will provide millions of dollars in new funding for 5 community health clinics in my district alone. And it will reduce the cost of uncompensated care for hospitals and other healthcare providers by $16 million annually. And I want to set the record straight. This will add and protect and supplement, not take anything away.
Representative Watson, thank you so very much. I am